So Farah, I am giving you the link, okay? So you just distribute the link to the participant, okay?
Okay, sir. Okay, sir.
I am making you host first, and please
Okay.
please you tell something about the course, okay? And after that, next Amruta can start the presentation, and you will make Amruta as a host, okay?
Okay, sir. Okay, sir.
Okay.
Sir, just I need some 1 minute.
Mm-hmm.
Yeah.
Now you are the host.
Yes, sir. Okay, sir. So,
Because I have to attend the dinner time from 8 to 9.
okay, sir. Okay, sir. No problem.
Okay.
So, so this course is like about, as you know, about applied psychometrics, and it is a foundation course. And you know that applied psychometric as a branch of psychometrics is growing rapidly with advancement of knowledge, rapid developmental of statistical softwares, and job opportunities in different manufacturing and service organization of private and public sectors. So, so this course will provide you skill building learning opportunities and applied psychometrics. This program consists of 5 instructional modules that are accessible on desktop or mobile devices. So you can learn at your own pace from any location. So it's a 6 months course, and it's a comprehensive program. So now we will start our PPT presentation. So our first module is Introduction to Applied Psychometrics, and we presenters will present from that module only. So first is Amrita. Amrita is going to present on BDI. Amrita, now you can introduce yourself with others, and
Yes,
you can present. Yeah.
I'm not able to share my screen.
Okay, let me let me make you host Amrita.
Yes.
Okay, Amrita, now you can share your screen.
Yes, ma'am.
Yeah.
Hello, can you hear me? Hello.
Yes, you are audible.
Is the
Yes,
screen
Amrita.
visible?
Yes.
Yeah.
Yeah, it's visible.
Okay, so hello, myself Amrita Arbhavi. I've completed my master's in clinical psychology, and today I'm presenting about applied psychometrics in the clinical setting. And I'm presenting on the Beck Depression Inventory, BDI 2. Yes. So, firstly, what is applied psychometrics? Applied psychometrics is the construction of a psychological test in which we construct the test to solve the problems of our everyday life. And it is used, so when we construct the test, it is mainly useful for in training, counseling, guidance, recruitment of employees, and for intervention. And in an applied psychometrician can select the tests that are good for testing. So the applied psychometrician has knowledge to understand and select the tests which are good and which are not. So in the clinical setting, the applied psychometrician can understand the applied psychometrician can differentiate between the test and select a test which test to administer on the patient. And here we are talking about the Beck Depression Inventory. Just to introduce, give the introduction of about BDI. It is a 21 item self-administered scale, which has a 0 to 3 list of 4 statements that are arranged. in a severity, that increases the severity about a particular symptom of depression, and it has cognitive, affective, somatic, and vegetative symptoms of depression. This is how the BDI test looks like. It has, as we can see, 0 to 3, the severity of the symptoms increases, and there are 21 items. The applied psychometrician's job is here. So in the previously we have understood, we have studied the reliability and validity of the BDI on the Korean adolescents. So here is the mean, standard deviation, and percentage and inter item correlation of the scale. So here, as we can see, the mean score for changes in sleeping pattern is high, and also for changes followed by changes in appetite. And so here, by why are we looking at the scores of the scale, is that because applied psychometrician can understand the mean score, where the mean scores are high in or low in the symptoms, and then accordingly can plan the intervention and help understand why the scores are there, and explain why the scores are high in a particular symptom or why they are low in a particular symptom, and where the scores are highest and lowest, and to and also to find out the reasons behind it, to justify and explain the reasons why the scores are as they are. Then the mean and SD that we saw. After that, there is also an inter-item correlation. So in inter-item correlation is the correlation where we understand how the one item is correlated with the other items of the scale. So the items that are there in the scale are measuring the facet that we want to measure. So in the inter-item correlation, we can see that the high correlation is between self-dislike and self-criticalness, followed by worthlessness and loss of energy. So the mean value is high for self-dislike and self-criticalness, is because here these are the cognitive factors, and whereas in the where we saw the means of these symptoms, the mean value for those were low, as these are as we discussed, these are the cognitive factors, and they are latent. So so the physical symptoms that are there, that means the loss of energy or changes in sleeping pattern are high. The mean value is high here because they are very easily we can observe that, and easily we can report about it. And here the inter-item correlation we saw. After that, yeah, concurrent validity scores are also calculated. So then applied psychometrician, it is very important to find out the correlation of the items, as well as to find out the concurrent validity. So it gives us the information about the test that we are the test or the test which we're measuring is correlated with what other tests, and the correlation helps us understand whether it helps us understand the test better. It provides the information on how the symptoms are formed and the factors that cause or contribute to the symptoms. So here, the different symptoms that we see of the depression, the concurrent validity help us understand that. And the concurrent validity means that all the tests that are there, that is the anxiety test, patient health questionnaire, state anxiety uh, test, and the trait anxiety test. So these are the highly correlated tests with the Beck depression inventory that helps us understand the other factors that are correlated with the depression. So here the applied psychometrician's job is to check whether the data that we get is theoretically correct or not, and help the counselor or the therapist form a intervention strategy that helps that is in line with the patient's symptoms, or the where the symptoms, the reasons and the contributing factors of the symptoms. Thank you.
Oh,
Amruta, thank you. Hello, Amruta, thank you.
Yes, sir. Thank you.
Yeah, so the function of the applied psychometrician now will be to identify the items, okay, where the scores will be very high. So if it is a 4-point scale and where the items score is more than 3, okay, then the applied psychometrician should probe instead of only the norm for the classification. Okay. So this is very important, particularly for the psychometrician and the applied psychometrician. In clinical psychology, applied psychometrician should probe. Okay.
Yes, sir.
Thank you, Amrita. Now, Farah, who is the next?
yes, sir. So next is Amit. Amrita, can you please allow him to share his experience?
Okay, I don't know how to do that.
Okay, can you please make, please
Hello.
make me host again. Yeah, please make me host.
Actually, ma'am, I have not prepared the PPT because I am outstation here to take examination. Hello.
Yes, Amit. Yes, Amit. Yeah, yes, Amit.
Can you tell me how to make a host? I don't know how to do that.
Okay, click on my name and then there are options. Click right.
Okay.
Yeah. Now
Make
there is an
host.
option.
Okay.
Yeah, make me host. Yeah.
Yes.
Okay. Okay.
Done.
Okay. So Amit, yeah, I know that you don't have time. So you have to tell me orally about your topic, and your topic is organizational health questionnaire, right?
Okay, can I present what the assignment I have put up regarding the assignment which you have given? Because I have covered almost all the aspects in the construct, means the facets there. So can I recite the my response?
Sure, Amit, it's up to you because I want something from your side. So if it is your assignment, you can go ahead, and then we will like give you suggestion on that basis. If it is covering all the domains and all.
Because what I understood from today's activity is that whatever the construct we are preparing, what aspects of the applied psychometrics are applied there in my questionnaire. That is what we want. That is what we want,
okay.
Na? Okay.
Yes, Amit. So there is a shortage of time, so you have to start.
Yes. So my regarding my that assignment, that I thought and searched for the factors that may lead to the loss of productivity in the manufacturing industry, like the dangerous equipments, injuries, illness, burnout, substance abuse, product defect, and logistic challenges. These were the factors. And there we can structure the organizational health questionnaire based on the number one, like physical health. So in that about the working condition, whether the company provides you with the enough working space, or like your working space is clean or and healthy. Second, about the safety, whether your health is at the risk from the machinery or the equipment you work with. Then about the mental health, awareness of the organization. At the end of the day, I know how much goods I have to produce. The second aspect, like autonomy, I can find and report the distractors in the daily work. Then third, about the organizational evaluation, like management takes your suggestion regarding working conditions and productivity. Fourth, like coping, management provides training and acclimatization to the new equipments on which you work. Then about the identification in the organization, management shows a strong sense of responsibility towards you. Then about the trust, management is aware of the shortage of the staff. About satisfaction, management makes decision for the benefit of the employees. Then about creativity, employees feedback is taken to address the low productivity of the company. Then about the third aspect, like social health, about environmental awareness, you can use a smartphone with continuous internet during work, or how much time do you spend on the smartphones at the workplace. Then about the environmental satisfaction, whether the administration addresses your issues compassionately. Then about the fourth facet, that is the spiritual health. Then about in that honesty, the administration counsels the underperformers. About social welfare, management inculcates the spirit of teamwork amongst employees. About equality, hierarchy is not a barrier in the interpersonal work relationship. And upon the openness, management addresses the faults and the merits of the employees accurately. And lastly, about the work as worship, job gives you peace of mind and financial security. Here, the rating scale may be yes or no, or it may vary from the strongly agree to disagree. So in this health questionnaire, what I think, if we get the responses, then the work of the applied psychometrics will be here, whatever the statistics is produced will be used to understand the management of the problems which the workers are facing with the issue of loss of production. Thank you. Hello. Hello. Am I audible?
Yes, Amit. Yeah, thank you. Sir, are you there? Okay. Okay, Amit, thank you. Well,
Okay, thank you, Amit. I am in dining room, so I cannot cannot tell many things. So this is okay.
Okay, thank you, sir.
okay. So next is Purvi. Purvi.
Yeah, so I will also be verbally presenting my topic because I couldn't make a PPT either. Can I start right away?
Yeah, Purvi, you can
Okay,
start.
okay. So my topic is BDI again, Beck Depression Inventory. And so I'll give some background on this inventory first. So it was first published by Aaron Beck, who is considered as a father of cognitive therapy. Nowadays, it is more cognitive behavior therapy. And this tool is designed to measure the severity of how much depression you have. And it is used as a screening tool. So basically, not exactly diagnosis, but it gives more insight to clinicians into what is going on. The BDI consists of 21 items. This so how this test is used, basically, as I said, for screening for depression and monitoring how the course of the treatment will go. And the higher your score is on this test, the more severe your depression is, basically. So for example, the score of 10 to 18 is mild depression, and 30 or above indicates severe depression. And interpretation about this is that it is a self-report measure. So there is some amount of subjectivity involved. So some people might exaggerate their symptoms, some people might downplay their symptoms. But so for applied psychometrician, it is important that we employ other tools as well to get a rounder information about the same case. The items on the domains in the Beck depression inventory are somatic, which is physical symptoms, affective, which is emotional symptoms, cognitive symptoms, and vegetative symptoms. This means any changes in your sleep, appetite, etc., will come in this domain. Some limitations of this test are, as I said earlier, it is a self-report measure, so some subjectivity comes in. This test only assesses symptoms of depression, no other factors like genetic predisposition maybe or family history. Another is that it is not specific to any one culture. This means that if depression symptoms manifest in some different ways in some cultures, this test cannot pick up on those. The BDI is used so widely because its reliability and validity are so good. Its convergent validity and discriminant validity is very good, which means that it correlates highly with other tests that measure depression, and it does not correlate highly, correlates negatively with other measures of symptoms of anxiety, for example. And so yeah, on applied psychometrician, for example, we'll see which domain is especially high for a certain client, and that is the area they need the most help in. And we will also not just depend on this tool, but we will also get a full focus of the client through interviewing them, etc. Yeah, that's all. Thank you.
Thank you, Purabi. When you present as an applied psychometrician, you have to give much importance on the items, okay?
Right. Okay.
Items is very important rather than the convergent test validity and other things, because it is the related the action research also. So you have to find out, you have to give much importance, because Beck's model based upon the cognitive distortion theory.
Right.
So if you can find some items that shows some reflection of the cognitive distortion, and then applied psychometrician will be concerned with that one.
Okay. I will keep this in mind for next time. Okay, thank you, sir.
Thank you.
Okay. So next is Pooja. Pooja, it's your turn. I'm making you host. Okay.
Yes, ma'am.
Yeah. Okay, Pooja, you can start your PPT.
So hello, everyone. So here is validity, one of the primary prerequisites of a good psychological test, apart from reliability and having standardized norms. So here on the screen, we look at 4 images, and there are few tests. One is a sentence completion test, other is special adult intelligence test 4, base 4, and next is an ink blot, which is a very famous projective technique test in psychology, Rorschach. And then there is a polygraph test. I have deliberately used these images to understand, to help us all understand what actually validity is, and which among the 4 is or could be a better valid test, which we can answer later once we discuss types of validity. The concept of validity was introduced by Kelly, and he said that validity is the quality or the attribute of a test to measure what it purports to measure or what it purposes to measure. And among the various types of validity, we have content validity, construct validity, internal, external validity, face validity, criterion validity. And so far, my understanding, the way it goes, I've understood that construct validity also is of two types, which is convergent and discriminant validity. External validity has a very famous application in ecological validity. Criterion validity has two types, two subtypes, which is concurrent and predictive validity. So I'll briefly try to simplify all of these types of validity. So if validity is what a test, like the test measures, what it purposes to measure. Taking example of BDI, because it's a test which is a topic of discussion today. If we were to say that Beck depression inventory is face valid, face validity is the most informal type of validity, which means that as soon as the respondent or the participant or the patient or the client sees the statements, items of the test, he or she gets to know what it is measuring. For example, one of the items in Beck depression inventory is, I have thought of ending my life in the past 2 weeks, similar to that. So that is highly talking about suicidal ideation. So that is a very face valid item. However, at the same time, if a test has very high face validity, it is also highly susceptible to social desirable responses because the testee now knows what it is trying to measure. So that is a loop side of face validity, and we cannot establish validity of a test only on the grounds of being face valid. Then the other type of validity is content validity. Content validity is that if I'm writing items with the aim of assessing depression or severity of depression, then the item should talk about depression. It should cover content of depression in a more holistic way. Like as Purvi and Amrita talked about, that BDI has vegetative symptoms, somatic symptoms, cognitive symptoms, and physiological symptoms. That means it is kind of trying to cover the content of depression in a more holistic way. Then we have construct validity. Construct validity in some places is also talked about as type of content validity, but I will try to talk about it separately. Construct validity, as the name suggests, is that whatever the central construct is of my test, it is assessing that construct. And when I'm assessing that construct, it correlates well with other tests measuring the same construct, a similar construct, which is convergent validity, like different tests coming together, converging. At the same time, discriminant validity is that different tests, like my test, is different from other tests. It is not assessing this different things. For example, if I am designing a test of depression, it is not assessing intelligence. If some items in BDI are also assessing intelligence or types of intelligence, that means my test is not discriminant enough. It should be able to differentiate between different constructs. Then there is internal validity and external validity. These terms, internal and external, are more closer to research when we are planning research, when we are doing research. Internal validity means that if I have introduced an independent variable and tried to manipulate it in order to see changes in the dependent variable, then the test, then the research has that high internal validity. It is able to establish a cause and effect relationship between IV and DV. And some of the factors which really affect internal validity is how do we select the sample? Sometimes there is a sample dropout when we are doing a longitudinal research. We call it attrition. That is also one of the factors which affects internal validity. Sometimes maturation, especially in developmental studies. When there is a maturation, increase in, like there is growth, there is development of a child from infancy to, let's say, adolescence or adulthood, things change a lot. That And that can also affect internal validity of that particular study. Then external validity. External means which is external to the study. That means when I am trying to generalize the results of my study, I am able to do that. My sample, which I took in the research, my sample is able to speak of the larger population. That is why external validity is also has type of ecological validity. Like when I am able to generalize, are my result able to justify the natural environment, the natural conditions of that particular construct being studied? Ecological means nature. Because we introduce ecological validity because most of the researches happen in an experimental setup, which is controlled. So one of the disadvantages of extremely controlled experimental condition is that it might not be much valid in the real settings. That is why these days ecological validity is highly, highly considered while planning research. Then we have criterion validity. Criterion validity is that is my variable, is my study being able to fulfill the criteria? What I am trying to assess, whether it is able to study the criteria. And criterion validity also is of two types, concurrent and predictive. Concurrent means co-occurring at the same time. In the present, whatever tools I have to study my construct, is it correlating well? Like as Purvi was sharing, that BDI has high concurrent validity. That means other tools of depression, perhaps DAS, BDI, together correlate. That is concurrent validity. Predictive validity is of the future. Prediction is a matter of the future. For example, I am designing a research on, let's say, we are designing a tool on intelligence, and we have designed, let's say, Rabindrake intelligence assessment tool like that. And we are trying to predict that students or children getting higher scores on intelligence test measure, which is developed in 2023, will have higher possibility of career advancement after 10 years. We are trying to predict their career by present scores. That is predictive validity. So these are, in brief, the different types of validity. That's all about my sharing for today. And this is just the references from where I took this. Thank you so much. Okay, yeah. So coming back to this polygraph test. Polygraph test is a very famous test. We call it lie detector. So if a question arises that is polygraph technique a valid technique to assess whether a person is lying or not? Anybody who would take a guess? Is polygraph a valid tool for assessing lie detection?
Yeah, it's not like permissible in court precisely because it is not a valid measure.
Right. That's true. Because it assesses physiological parameters. And anybody who is, put to a polygraph can have increased heartbeat and increased pulse rate. That doesn't mean anybody who is having some certain body parameters is lying. It could be also due to the experimental condition. So polygraph is not a very valid tool. It could be a valid tool to assess anxiety levels, but not lying, which is a highly cognitive and multidimensional thing. Similarly, Rorschach in block test. It's very, very famous, one of the most famous, well-researched projective technique used in psychology till today. Still, that tool is not completely valid because it is projective. So it assesses different things, and we cannot solely on the basis of Rorschach tell that somebody has this type of schizophrenia. We can have a hint that these are signs in favor of psychosis or in favor of active or underlying psychosis, but we cannot certainly use that. So we have to corroborate Rorschach with other techniques, majorly which is interview. Then coming to WAIS, Western Adult Intelligence Test. WAIS is among these and also among other tests of intelligence, one of the most valid tests because it is very comprehensive. If we have to really see, not just WAIS has high face validity, but also it has high construct validity, content validity, convergent and discriminant validity. WAIS has multiple uses and we can assess intelligence, learning difficulties. It is also a neuropsychological test, so as to say. So because it covers holistically the verbal and performance components, and it is getting highly culture free also. Different cultures can use base, especially the performance part. That makes it highly valid. Then sentence completion test. To use the technical term, sentence completion test is a semi-projective test. It has blank statements, and the first few words, the first initial stem is given to the client or the patient. And this makes it slightly skeptical in terms of validity. People can fill sentences having highly social desirable responses because they are getting the few keywords. Some people can really come out with, the truth. So we cannot completely say that sentence completion test and Rorschach test are solely independently used as in order for diagnosis or treatment planning. We have to corroborate some test with interviewing technique and other tests. So in general, in my experience, the way I understand, batteries are highly valid as compared to questionnaires and tests. And then comes a projective test to put as a hierarchy in terms of psychological assessments. Thank you so much. That's it.
Thank you, Pooja. Very nice presentation. So I am requesting you, please you write some of the units, okay? And for that reason, I will send you one letter to you. So please you talk to Farah so that I can send you the letter where you can write down some of the chapters of the applied psychometrics, okay?
Yes, sir. Yes, sir.
Farah, please you talk to me later on, okay?
Yes, sir, sure, sir, sure. Yes, sir, sure, sir. Yes. Okay. So now next is Sarah. Sarah, are you there?
Yes, ma'am. Yes, ma'am.
Yeah, Sarah. Okay. Now you can start your PPT.
Ma'am,
You are presenting. You want to present slide? Oh, your network. Sarah, yeah, your voice is not clear, Sarah.
hello.
Yes, now we can hear you. Okay. Sarah, I'm making you host so that you can share your screen. Okay. What happened? Okay, she left. Sir, there is a network problem. Sarah, are you there?
Yes, I just got kicked out of the meeting. My network dropped.
Okay, so you want to share a screen or you want to present your PPT orally?
Yes.
You want to present?
I actually made a short PPT.
Okay,
I'll try if it is visible. Otherwise, if I do get kicked out again, I have to present orally.
Okay. Let me make
Sarah, one of us can share the screen for you if you can WhatsApp.
I'll try that. Yes.
Sarah, I'm making you host. You can start presenting your PPT.
Okay.
Yeah. Go ahead.
Just a second. Is the screen visible? Hello.
Hello. Yeah. There is nothing on the. Yeah. There is
Achha, okay.
Yeah. Now I can.
Screen is not. I'm. Is it visible now?
I can see the
Hello.
desktop, but yeah, I can see the desktop, but yeah, now I can see your PPT.
The slide is characteristics of a good psychological test and overview. That's visible, right?
I saw the title and now there is no screen. I mean, there is no PPT.
Okay. I think it's not. I'll have to present it orally only, I think, because it's not getting shared also.
Oh, okay. No worries. No worries.
Okay. So the topic that I would be presenting today is the characteristics.
So, Shara, you can do one thing. You can present your voice in the WhatsApp. Okay. So we will follow in the WhatsApp.
Hello.
Hello, Shara. You can present your voice in the WhatsApp. We will follow in the WhatsApp. No problem.
I didn't get it.
Then, Farah, what will be our decision?
Hello.
Should we stop it? Or...
Okay. Sarah, can you please, can you please record everything what you want to like present on WhatsApp and just send it to us on WhatsApp?
Okay, I'll do that.
Yeah. Okay. Okay. Sir,
thank you.
Yeah, sure. You're welcome. I don't want your efforts to go waste. So, sir, then, sir, she will send us on WhatsApp, sir. So, sir, I think we can.
Okay, then everyone has presented whatever they have understood about applied psychometrics nicely. So, thank you, everybody. So, I am closing it.
I have one question for Pooja, ma'am. Hello. Hello. Hello.
Yes, Dr. Amit, please go ahead.
Yeah, Pooja, ma'am, very good presentation from your side. I just for this just sake of understanding, my question was like there are so many types of validity. So, is there any classification where in which type of study we should apply which type of validity, or it gets just crossover is there?
So, in books, when classification of validity is given, it is usually given in terms of content validity and criterion validity. And criterion validity is divided into concurrent and predictive, and content into sometimes face validity and construct validity. And in few books, then conversion and discriminant is also given. So there is a bit of a, I would say, overlap. But the process of validation, that how do we establish validity, is through correlation. That is central. And face validity is usually asked from the participants and also the judges. While reading the items, are you able to understand that this particular test is trying to measure this? Other validities are, the food of validation is correlation. So that is a common ground as far as my understanding is concerned.
Okay, means
maybe
we have
sir and ma'am can add. Yes.
So it means it is our intuition or our intellectualness, where what type of validity we want to attach or study.
Construct validity is something which construct content validity is something which is put on a high priority, because that the test has to measure that constant which we are trying to measure.
Because
when it is,
normally, if we construct any questionnaire, it is our job. So if we give our construct for the validation to someone else, whether he will apply his acumen, whether this type of validity or this type of validity, it should be checked.
Yes, that is like two-way process. We also ask the judges. Judges are the experts who have worked in that particular field, sometimes in particular, let's say, psychological disorder per se. And the other is our own correlation with, when we get the data from pilot studies.
Okay.
So both the judges and the participants, the research participants, are the people who help establish validity quantitatively as well as qualitatively.
As such means in any literature,
Hello,
there is
Pooja.
nothing.
Hello.
Yes, sir.
Hello, Pooja. I have one question to you, because you have
Yes,
told
sir.
that is the predictive validity includes the criterion validity as well as the concurrent validity. So when you are talking about the prediction, so that is very much related to the future, right? So how future can be the present? I think you have understood. I think you have understood my point, right? When you are talking about the predictive, so that is the future. And the concurrent, that is the present.
I'm sorry, sir, I couldn't hear you. I just could hear that if predictive and concurrent are both in criterion validity.
Yes, whether both are criterion validity or they are independent.
Both are criterion validity.
How
established at various points of time.
Yeah, so what will be the criteria for concurrent validity?
Time, at the same time. And there it would be different times.
No. Concurrent validity, the criteria will be the another test. Okay, for example, Spielberger state and trait inventory. Okay, so this trait is highly correlated with the neuroticism of Eysenck personality questionnaire. But state is not highly correlated with this. Okay, so that means the Eysenck personality questionnaire neuroticism, that is the criteria.
Okay, sir. Yes.
And here you can find out both the convergent and the divergent validity. The state anxiety, that is not correlated with the trait anxiety, but trait anxiety is highly correlated with the neuroticism.
Yes, sir.
State is not related. So state, when I am correlating state anxiety with the neuroticism, and when it is not correlated, so it is a divergent. And when my trait anxiety questionnaire is highly correlated with the neuroticism, that means convergent validity is high. Again, the concurrent validity.
Yes.
Okay. Thank you.
And
everybody has presented their paper.
So just a follow-up question. So even the predictive validity will have test as the criteria?
Predictive validity, yes, definitely. The criteria is there. For example, job satisfaction and absenteeism. So absenteeism is your criteria and job satisfaction is your primary data.
Yes.
Okay, so that is possible. And this academic achievement and the intelligence. Academic achievement and intelligence. Academic achievement, it is your predictive validity. So that is your criterion validity, criterion. And your intelligence test is your test.
Yes, sir.
Okay. So whatever you have told, that is correct. Okay. So except Shara, I think everybody has presented their paper. Shara has some network problem, so Shara will present. And I think now you have understood the basic difference between the psychometrics and applied psychometrics. Psychometrics is not very much concerned psychometrician. They are mainly the test score, norm, etc., etc. But applied psychometrician will be very much concerned with providing the service, okay, based upon the item response. Applied psychometrician, applied psychometrics is the part of psychometrics, but the applied psychometrics mainly concerned with providing the service. Okay, that is very much action oriented. Okay. And particularly the knowledge, that is important. Amruta and Porobi, they have presented BDI. And the BDI basically based upon the cognitive distortion theory. So there are different types of cognitive distortion. So when they will present, then they have to show some about the types of cognitive distortion and how the items of BDI are related to the cognitive distortion. So only the BDI score is high or BDI score is low. That is not sufficient for the applied psychometrician. Okay. Nobody has presented paper on norm. Whether you have not understood norm and the reliability also. So if you have any difficulty, please inform Farah.
Yes, sir. Yeah.
Eh?
Sir, they have actually one doubt related to norms and validity and reliability.
What was the doubt? Please you give me. Now I am free.
Okay, sir. So Pooja, you can ask. Yeah, that was your doubt, I think. Pooja, you can ask.
Yes.
Pooja,
What
yeah,
is your
you can.
doubt?
Yes, ma'am. So, sir, when we were given a statement that validity is a prelude to reliability. So,
what will be the
prelude
correct
means
answer?
Yes, sir.
What will be the correct answer?
Sir, I don't know the correct answer, but I understood that it is not a prelude to reliability.
Correct.
And the justification.
Yes,
I understood.
reliability is the prelude of validity.
I wrote the opposite, that it is not
reverse, I think.
Yeah, so reliability is the prelude of validity. Initially, we have to find out whether the test is reliable or not. If the test reliability is very low, then the validity will be seriously affected. Okay. But why it is affected? Can anybody tell me? For example, you have developed one test. Maybe that is measuring the intelligence. Okay. And you have noted that is a convex alpha very low. Okay. And you have tested the split up reliability, that is also low. So you are thinking, okay, I have done the reliability test. So that part is over. Now I have to correlate it with some criteria. Then again, you will find that is the your correlation with the criterion, that is low. The reason is very simple. Because when your test is not reliable, that means there is a lot of ambiguity in the response pattern. Okay. So when you find your test is highly reliable, that means there is least ambiguity or less ambiguity. Okay. So when there will be least ambiguity, then the convex alpha, that will be high. And when you will correlate your test with other criterion related test, then again you will find that is the validity coefficient of this, that means the correlation coefficient, that is high. Okay. So the reliability is prelude of validity. So Johnny, yes, Papa. Eating sugar, no, Papa. Telling lie, no, Papa. Open your mouth, ha, ha, ha. So initially, father tests the reliability. After that, the validity. Okay.
Yes, sir. And
So
so
now
next, there was another doubt. Maybe we can take it in next class if we have crossed the time.
Which time?
Sir,
Sorry, not
if we have crossed the time, then we can maybe take it up on Wednesday. The doubt is that how do we ascertain which transformed score is best for a particular test among percentile, STEM, Z, T score? How to choose?
Okay. Now, in case of the percentile, you have to follow the knowledge test. For example, academic achievement. In that context, you can use the percentile. Okay. But that is for the personality test. And their percentile is not important. So how many people scored correctly and how many people scored false. So that is not the issue in case of the personality. So in personality, we can apply the T-score, we can apply STEM score, we can apply Stanine score. But when it will be the knowledge test, achievement test, then you can use the percentile. Because percentage is there, no? Percentage, then you can use the percentile. Percentile as a norm. Is it clear?
Yes, sir. Yes.
Anything more?
No, sir. I think this. No, sir. I think other than this, nobody have any doubt. Amrita Purvi, you have any doubt? Sarah, sir. Okay.
So all doubts are cleared?
Yes, sir. Yes, sir.
Okay. So how many days are left only for AP0? Only
Sir,
1 day?
Yes,
or
sir, 1
no
day.
day? Only 1 day. Okay.
Yes. Sir, Wednesday and Friday.
Oh, 2 days are there.
Yes, sir, 2 days.
And what are the units are left now? Any unit left?
Yes, sir, the last one, the nominal and the ratio scale and the other two scales.
Acha, nominal ratio.
Yes.
Okay, okay.
Yes, sir.
I think now they have understood what is nominal and what is, because I have presented them, the socioeconomic data, that is the nominal scaling.
Yes, yes, sir.
And this reading, writing, motivation,
yes,
that is also The two things are there, 1, 2, option 1 or option 2.
Yes,
That
sir.
is also the nominal scaling.
Yes,
And
sir.
organizational health, that is the interval scale. I have not told them the ratio scale.
Yes, sir. Ratio needs
Ratio
some
scale
time.
and the rank order scale. Okay. So this Rabindric value preference, that will be the rank order scale.
Yes.
And ratio scale, I will tell. Okay, I will tell it.
Yes, sir. So
Today is
ordinal
the-
and ratio. Yes.
Okay.
Okay. Sir.
Then I
Yes.
think it will be over, right?
Yes, sir. Then
So-
this unit.
Ma'am, and sir, one last doubt. In types of questionnaires, how do we understand types of questionnaires? Is it on the type of construct we are measuring or the response format, or like what is the criteria of
Types of questionnaire, because you have to think about your standpoint, that is your anchor. Okay. For example, if your anchor is the response pattern, so the response pattern may be the binomial, yes, no type. Another one is the rating type. So this is one approach, types of questionnaire, based upon the response pattern. Okay. And if you think, no, another approach, that is the projective and the non-projective approach. So it depends upon, that is, from which perspective you will think about the questionnaire. Okay.
Yes, sir.
The scaling perspective you can think about, because the rank order scale, another one is the rating scale. Some scale is ratio scale also there. So it depends upon from which perspective we will tell. Your classification based upon the perspective. Okay.
Yes, sir.
Any more?
Pooja, any more?
No, ma'am. No.
Okay. Okay, sir. So I think we are done for today. Thank you, sir, for the
Okay.
time.
Thank you.
Yes, sir.
Of you.
Yes, sir. Yes.
Thank you, sir. Thank you, ma'am.
Thank you, Pooja. Thank you, everyone. Thank you for presenting PPT
Thank you. Goodbye.
orally.
Thank
Yeah,
you, Farah,
okay,
for
yes.
motivating students. And that
Yes,
is
sir.
vital. I have visited several universities, not only in India, but also abroad. Everywhere I find that is the presentation of PPT. Presentation, repeatedly presentation.
Yes.
My students in Punjab, IIT, she is telling, sir, regular PPT presentation. It is not.
Yes, sir.
At least in the morning, teacher taught everything, and in the evening, you have to present everything in PPT. Sir,
Yes,
this
sir.
is
It's
so.
a
This is
skill
the
that
style. Actually, in
yeah.
this way, if you can train the students, then students will not
Yes.
forget, and students will be highly trained.
Yes, sir. That will boost their confidence, and it is a kind of a skill that I think in every field they needed this.
Hmm.
This is not only a presentation, but this is a skill that they are developing.
Yes, they will develop the confidence.
Yes, sir.
That is vital. So in near future, any sort of interview facing the public presentation, etc., they will be able.
Yes, sir. Yes.
So we will start one poster presentation workshop. I'm planning. So they can present.
Yes. Sir. Yes. Sure, sir. Sure. Okay, then
Okay.
yes, sir. Okay, everyone, thank you so much. You all have done a good job, and we are proud of you. So now just take some rest, and good night, everyone. Thank you, sir. Take rest,
Thank
sir.
you.
Good night.
Good night.